palate treatment is an ongoing journey for the child and the parent. Generally, these children are seen multiple times across the lifespan, and how many times they're seen during their lifespan depends on the extent of their cleft and their response to the surgeries. So what we're going to start with is the cleft lip, and this is generally the easier or simpler of the clefts, because once the cleft lip is repaired, it's generally a cosmetic surgery after that. If any surgeries at all. If it's a cleft lip that extends into the alveolus, then there is more surgeries in the future to close that alveolus, depending on if they weren't able to do that the first time. And if it is a cleft palate, then they're really likely to go through multiple surgeries depending on their overall healing process and their muscular response to the surgeries and their speech outcomes. So in the beginning, they have optional nasoalveolar molding, or NAMS. This is a device that's placed between the alveolus so that the alveolus can be shifted and shaped together to make this hole in the palate smaller. So this usually happens between 1 to 3 months of age, and it's a very gradual process. It's essentially like braces, but it's the molding in the roof of the mouth to make the gap smaller between the two edges of the palatal cleft. The cleft lip repair happens around 10 weeks or 10 pounds or a hemoglobin of 10. And that's just essentially proving that the child is healthy enough to go through surgery and to support themselves after surgery. So you can see this child on the left here had a cleft lip, and after his surgery, you can't really even tell that he had a cleft lip. And so he may never need another surgery again. If he's a child that, it scars later on, or there's poor scarring after that surgery, then they may go back and do more of a cosmetic surgery with a plastic surgeon, but overall that might be a one-and-done surgery, and he doesn't have to deal with anything else in the future. If it's a child that has a cleft lip and a palate, then they'll go through the cleft lip repair around 10 weeks or 10 pounds, and then they'll go through the cleft palate repair around 9 to 18 months. And this is the same if it's a child with a cleft palate without a cleft lip, they'll go through the cleft palate repair between 9 and 18 months. This is generally a first surgery. Some children need to go through multiple surgeries after this one, depending on their outcomes, but this is when the first one happens. If it's just the one and only surgery, that's wonderful. If it's not, then they'll come back in a few years. So in this child, you'll see they have that complete unilateral cleft lip and palate. It's affecting his dentition, or his teeth here in the front. But overall, once they've closed that palate, everything looks really good. What happens after this is a healing process as the child grows. So a mouth that is the size and shape at 9 to 18 months is very different from the size and shape of a mouth at 7 years or at 17 years. And so during this healing process, and depending on the child, what they're eating, how they take care of their mouth, things like that, they can really have different outcomes that can impact their future surgery and path. So in some children, they may do a palatal expansion. This is around 5 to 7 years. It's with the orthodontist. And they're opening up the remaining cleft in the alveolus, if there was an alveolar cleft, so that they can get it ready for a bone graft. And this bone graft is there to help with the tooth development, so that the teeth have enough room to grow and a place to hold on to. And then around 6 to 9 years, they have an alveolar bone graft. And if they have a fistula, they have the fistula repaired. And that fistula is just an opening in the roof of the mouth that remains as a repair of the cleft. It can also be a result of poor healing after the initial cleft surgery, where the tissue is what's called dehisced, meaning that the two tissues on either side of the cleft that they pulled together separated, creating that fistula. Around 6 to 9 years, they might also go through a tip rhinoplasty if they had problems with the nair kind of folding over on the front. Then they go through and do just a nice little nose repair. Between 6 to 9 years, they're also getting their first phase of orthodontics, and that is to create that dental arch, and it goes along with the palatal expanders. They go through phase 2 of the orthodontics between 9 to 13 years, and that really gets more closer to the dental arch. They might have dental implants. They have the bone graft to support the teeth. Around 13 to 17 years, they have orthodontic surgery or jaw surgery if they had a recessed jaw that went along with their cleft palate. Now, I give you this timeline again as a general idea of really the process that the individuals with cleft palate really have to go through and how that can affect their overall compliance with these surgeries, their want to go through these surgeries, what they're experiencing as they're going through in terms of what their association is with their mouth and how good things feel in the mouth and the things that they're able to eat, or even how they're speaking. So in some cases, these children might also go through additional evaluations around 3 to 5 years old, 5 to 7, or 13 to 15, or 13 to 17, to see how the velopharyngeal port is functioning and if it's causing a resonance disorder. And it has to do with the growth and development of speech. So growth of the anatomy of the face and the development of their speech sounds. So around 3 to 5 years, these children really have continuous speech. They're putting words together, and their overall intelligibility can be impacted because the velum can't quite keep up with how much they're producing in their speech sounds at that time. And it can be due to a short velum or a tight velum, or any kind of problem in the velum that's affecting their overall ability to close that velopharyngeal port. So if we notice that that's a problem between 3 to 5 years, they might go through a second surgery for the soft palate. If we notice that there's a problem at 5 to 7 years, they might go through a second or third surgery. And even between 7 to 9 years, when the adenoids recess, maybe the velum was compensating well because the adenoid pads were in the back of the pharynx, so it didn't have to go so far. But once the adenoids recessed, there's really a gap in that velopharyngeal port. Then they can go in and either bulk up that posterior pharyngeal wall or the back of the throat, or they can add tissue to the velum so that it can create that sphincter. And then between 13 to 17 years, these children are going through puberty, and so that we have growth of the head, where maybe the velum was long enough when they were younger, but with growth it's really not extending and growing to close the velopharyngeal port, so they're having more difficulty. Now that's the typical timeline for someone with a cleft lip and palate. That journey really varies depending on, again, the extent of the cleft, and it can also become a wider or more varied treatment plan if there is a syndrome. So some of these children with syndromes have other issues, other problems that physiologically are impacting their ability to close the velopharynx, or their intelligibility, or their communication development, that really impacts their overall ability to heal from surgeries, or for the tissues to keep up with the surgeries that they have to go through in that healing process. So just keep in mind this is a general path, and it's not the path for everybody, but it is one that is long and can be complicated for them. So what I have now is a case example of a 31-year-old male who had a bilateral cleft lip that extended into the palate. So we see at 4 months old, we have the cleft on either side of the nair, which is also creating a flare in the nairs. And what I want you to really notice in this image is that all of the structures are there. We can see that we have the sides of the lip here on either side, and we have the top of the lip here, and this is where the philtrum would be, and we have the nair, but what we really see primarily is the cleft. And once we close that cleft, we have just a typical looking face. And that's really ultimately what it boils down to, is these are typical kids. They just have a little bit of a difference in their development of their face. And so it's not an intimidating thing. It's not a wound. It's not an injury. It's just things aren't quite lined up where they need to be. And so over time they go through surgeries to help with that. And so this is him at 14 years old. And again, he probably didn't have all of these extensive surgeries in between. He had more orthodontic type things. but it is still a process. So we can see at 14 he has just a general lip here at the top, but it might look a little different on his face. So they went in here around 17 and did some more plastic surgery type things. And at 21 years old, with and without a smile, we can see already there's a difference in how much that top lip extends while he's smiling, and it remains tight into 31 years old. But when he's just at rest here at 21, he really looks like a normal, healthy guy. In this second row, we have the orthodontics that are involved. So you can see we have, even though that lip was repaired by 17, we have the gap that remains in the teeth, and so he has the braces to help pull those teeth together and more towards midline. And then he may have gone through a bone graft to fill in these gaps between these two teeth, because they have to have something to root these implants on. So in order to install the implants, they'll put in a bone graft, which is what he has here at 21 and again at 31. But overall, once he's smiling here beyond 18, we have just a typical looking smile, and you have very minor signs that there was a cleft palate there at all to begin with. And then this is the picture of the roof of the mouth. We have a flap here at the front, which shows us that they had to recruit in some tissue to cover up the palatal cleft on either side, and they may have gone in between 14 and 18 years to remove some of that bulk from the flap, but overall it's pretty good healing, and by the time we get to 31, everything's really just looking like a normal, healthy roof of the mouth. But you can see that we have just a change in this alveolar ridge, where typically this would look bumpy, but it looks very smooth because of the scar tissue from the flap.